what is the Haemovigilance, and to start, presentation of the French system network.
It's a complete survey network made of professionals at different levels. They work at a local level, a regional level, and a national level. They observe, declare, and analyze all adverse effects observed in blood donation or in transfusion patients. They are also aware when error or dysfunctions occur all over the transfusion chain.
Okay. And what are the Haemovigilance correspondent missions?
We have a correspondent in every blood bank in France, and also a Haemovigilance correspondent in every clinic, public or private health structure. And their first mission is to get a perfect traceability for all blood products delivered or transfused in their own structure. Their second mission is to declare adverse effects observed in blood donations, during blood donations, for the blood correspondent, blood center correspondent, and also all the adverse effects observed in patients for the correspondent working in hospital or clinics.
Okay.
And the third mission is something more general. It's to transmit to the epidemiologic institute all the serologic data on positive donations.
So 3 missions for the correspondent?
Yes, mainly 3 missions.
Okay. And what was the main difficulties to implement the system?
At the beginning, in 1994, we had to convince our colleagues that traceability was really useful in order to obtain a better security in transfusion. It was not only to fill more and more papers, but really a benefit for the patient, and in case of a donor's health problem, to find the recipient. So it was the main goal of the first mission of Haemovigilance. In 2006, we completed the system by a mandatory declaration of all errors or dysfunctions all over the transfusion chain. And once again, we had to explain the benefit of this declaration and analyze the dysfunction in order to get a better process and less errors.
Okay. So thanks to this system, you have improved your traceability.
Yes.
And what data must be saved to guarantee the traceability of blood products?
We have to keep a certain numbers of information. First of all, the number of the blood product transfused or the evidence of its destruction. It's important. We also have to keep the name of the nurse and the doctor in charge of the patient, and of course the side effects, if there are some. And all this data must be kept a long time, 30 years.
30 years?
Yes, in the patient's file and also in the blood bank delivered the product.
Okay. And what are the adverse effects in blood recipients? Sorry.
There are numerous possible adverse effects in blood transfusion recipients, from the simple febrile non-hemolytic transfusion reaction, or the minor allergic reaction like urticaria.
Okay.
And fortunately, not so common, the transfusion of blood contaminated with bacteria, or the transfusion acute lung injury, and sometimes ABO incompatibilities. For example, last year in France, we declared 9 ABO incompatibilities, 31 trailing, and 9 bacterial contaminations.
Okay.
So all these data are collected at a regional level and a national level, and they are published in an annual report, which is put not online on the website of our sanitary agency, which name is AFSAPS in France.
So it's a new way of communication also.
Yes. It's easy.
Yes. And how do you declare adverse effects so in blood recipients?
It's quite easy. It's an online declaration. So all blood banks, Haemovigilance correspondents are connected to a secured website of the sanitary agency, and they declare online on a special form all the adverse effects in recipients, all the serious adverse effects in blood donors, and all the serious incidents of the chain.
Okay.
All is declared. And when the declaration is checked, finished, controlled, the three correspondents, the local, the regional, and the national correspondents, are informed at the same time by an email, receiving an email. It's so quite simple.
Quite simple, like a click on the website.
Yeah.
Do you think that the current French system reduces significantly the transfusional incident?
Yes, a better knowledge of adverse effects can really impact strategy, political strategy, and reduce adverse effects. Let's take two simple examples.
Okay.
The ABO incompatibilities. In France, we had in 2000 nearly 20 cases per year. In 2005 it was 15 cases, and nowadays it's less than 10 cases per year. Why? One reason is probably of the reinforcement of nurse training for the pre-transfusion test, bedside test.
Okay.
This test is made of two main steps. The first one is to compare the patient's name, the person you have just in front of you before the transfusion, to the patient's name written on the document linked to the blood product. And the second step, it's our specificity in France, is to perform a simplified ABO group on the blood of patient and also on the blood of the segment, the blood unit you have to transfuse, in order to check for ABO compatibility. It's done on a small cart with dried reagents, and the nurse training has probably contributed to the reduction of this risk, probably. But it's not perfect, and human errors still occur, unfortunately. The second example is Traili. Traili have been under-declared in France until 2003, and after being aware of this risk, more Traili were reported, and for the last 2 years we have 45 and 31 cases of Traili reported in France. And the EFS, the National Blood Establishment, has decided this year to take new measures for selection criteria of apheresis donors in order to reduce the risk of Traili. So we will look at our results, Haemovigilance results at the end of the year, to know if these measures are quite efficient. And we hope that we will reduce the risk of Traili and the incidence of Traili in our patients, just as it has been observed in Great Britain, where they have taken the same measures.
Okay. So, thank you very much for your clear answers. Is there any more you would like to add?
Yes, in conclusion, I would like to say that I think a complete haemovigilance system is an irrepressible tool of survey and analysis of the whole transfusion chain. It's really important. It's somewhere the ultimate quality control of a blood service. and it can help really improving our practice and blood transfusion security.
Okay, thank you very much.